Welcome, viewer, whoever you are. I'm very excited to be having this conversation with Carolina Correa. This is going to be a conversation about psilocybin therapy and how and why it can be so effective for emotional healing and transformation of all kinds. So it's going to be a very information-rich conversation. I hope that you learn a lot from it. But most importantly, we want it to be actionable too. So please do stick around through the end. Skip around if you're watching the recording to find the parts that are most interesting to you. But at the end, you're going to be able to learn about how you can take the next step and see if this modality could be appropriate for you. So I'm going to introduce Carolina now. She is the founder and clinical director of Numia, which is a legal psilocybin-assisted therapy center in Denver, Colorado. Yes, such a place does exist, and yes, she is right there at the bleeding edge of what this modality is becoming and how it's becoming more accessible to people. She is a psychotherapist. So prior to working with psilocybin legally, she was doing traditional psychotherapy, focused on relationship dynamics. She's known for a very warm, client-centered approach, and I can definitely echo that in my experience working with her, not as a client, but just as a human being. She also holds a master's degree from Antioch University, and she received her training in psilocybin-assisted therapy from Naropa University in Boulder. So I'm excited to have you on, Carolina. It's going to be a nice conversation. How are you doing?
Thank you so much, Henry, for having me here. It's really a pleasure to be able to explain to people the benefits of this modality of treatment, to explain more about what Numia is, why I created this space, why is it bringing meaningful work for people who come to find a new direction for their healing. Um, for people who've been struggling for years with different conditions, or even just someone who wants to find a new direction for their lives. So it's really nice to have this space to be able to share the work that we do here. And I certainly appreciate you um, doing this and being here, asking me questions and being so interested and also getting to know more about what I do.
hmm Yeah. So both of us have tossed out like a wide array of different reasons people might be coming to this, but let's assume no knowledge in the viewer right now. Can you just give us a very simple explanation? What is psilocybin assisted therapy? And maybe from a personal standpoint, what initially led you to wanting to learn more about it?
Well, psilocybin-assisted therapy was created as a legal protocol where people can use psilocybin in a space that feels safe and especially at Numia very warm with a guide, the guide of a therapist who will be with that person the whole time throughout the process. So um, there is a period of this treatment that is a preparation. So you don't just get here and do a journey at the clinic. You are prepared by a therapist to really understand what is that you're looking to achieve with this treatment, to screen for any conditions that might not make you a good candidate. So it's very safe. We make sure that you are, a good candidate. Also, we prepare you find an intention for your journey. We believe that the intention really is the North Star for this. That's gonna help you get to where you want to be. And so this is just like the beginning of the process. And this takes a couple of weeks where you meet with a therapist for a couple of hours each and really get to create the alliance with a therapist that I think, in my opinion, is 70% of the work in this. And then you have the journey, which is a day at the clinic for many hours. You have to stay with us for at least 5 hours. You're cared for the whole time. You are reminded of your intention. We help you with grounded techniques so that you stay present in your body. And you just have this attention for you throughout the whole experience. And then after that, we don't just let you go and like go back into your life with no attention or support. There is a period of integration where you still meet with your therapist for hours to process the experience, really understand how you want to implement that into your daily life and find real changes that can be sustainable. So that's just me explaining like the gist of it. Yes.
Great. Thank you for the overview. I am curious though, what inspired you to get involved in this modality? Like, and why create Numia?
Well, I'm from Brazil, and my background is in anthropology. So that's where I started studying indigenous tribes and got in touch with psychedelics and the power of this medicine. At that time, it was more the understanding of what ayahuasca can do for people in ceremonial contexts. So I had the opportunity to experience that with different indigenous tribes in Brazil and really saw the power of it for healing experiences in this traditional context. And then moving to the US, becoming a therapist, for many years I realized that even though talk therapy is so efficient, at times it lacks an extra tool. I realized people needed an extra tool to go deeper and access traumas that perhaps were difficult for them to experience or re-experience so that they could move through it. And with that, and my own experience with psilocybin that truly just made me understand the power of this medicine, I thought that we should definitely open a space where people could have the possibility of having this extra tool and really go deeper into their healing journey. And so that's how I created Numia with the idea of bringing clinical rigor at the same time that we really proud ourselves in being a space of a lot of warmth and human connection where people can feel held and cared in this process. We understand that people many times come from different states and they put themselves in a vulnerable place because it takes a lot to make a decision to do something different. They've tried many things without results. And so we're very careful to make sure they're cared for throughout the whole process. And so that's how Numia was created. And what's interesting about Colorado is that here, if you are a center with like Numia, with only therapists who are clinical therapists, we have the unique opportunity to consult with the previous provider. So we have, which I think is really an advantage to be able to see where someone is in their process, if they have a therapist, if they have a psychiatrist and to, to sort of like have this multidisciplinary approach to this.
Yeah, that's a great point. That continuity of care is super important in terms of people's safety and the efficacy of the treatment. And at least at this point, this is the only place in the United States where you can have that legally.
That is true in Oregon and Colorado. But in Colorado, how we were saying, the differential is that
Mhm.
if you're a clinical therapist, you get to talk with someone's previous therapist or
Yeah.
current therapist and psychiatrist. So that's really important for us. And the reason why I created this model, Anomia, that's based on the clinical model.
Yeah. Okay. Uh, I appreciate all that context. I think it's helpful for people. Before we get into, more of this conversation, especially around, what a potential client could expect, if you're open to it, I would love to hear a little bit about your personal experience with psilocybin because, speaking for myself now, I would not be working in this space had I not had a profound personal experience myself. And I imagine that drives a lot of what you do. So are you
Yeah.
open to sharing some more of that?
Yes, no, that's okay. And I think that's important. And most people I come across in this space, if it's not everybody, has had a profound experience with psilocybin. That's what makes us want to be in this and believe in it so much. So for me, first of all, like how I was saying, just being part of this community in Brazil of indigenous tribes and also Santo Daime and experiencing the tremendous impact on people's lives and how it built community, how it made people feel closer. So I understood that these medicines have a potential of creating connection and making people see life differently. That was the beginning of it. But then with psilocybin, before I decided to study it and to use it as a clinical tool, I was experiencing with psilocybin and felt tremendous change in the way I perceived myself, in the way I communicated with others, my ability to stay present in the work I do. And so I thought it was truly important to just share that with people because, I don't think just we should just keep it to ourselves, right? It's such
Mhm.
a wonderful thing for people to be able to experience and change things in their lives.
Yeah, that's beautiful. Thank you for sharing that. In addition to this like feeling of presence that you mentioned, another
Yeah.
really common thing that people experience is a sense of connectedness to one another. So I think that fits perfectly with this idea that once you've had an experience, you want others to know about it
Yeah.
and hopefully do it in a safe and responsible way.
Yes, and I think that's what you're saying, like doing in a safe, responsible way is not as a therapist, I don't just recommend for anybody to go and do this recreationally. And I don't really want to give much of an opinion on that. I think everybody
Yeah.
has their own journey with it and it's valid. Absolutely. And before we had the possibility of doing this above ground, that's all we had, right?
Mhm.
But for people who are not experienced and they really wanted to be in a safe space, in a legalized frame, I think that at Numia we offer both the clinical and the warmth and in the connection and everything that someone needs to feel at home and feel really cared for and very safe that they're gonna do this and come on the other side with a lot of results and feeling that it was a profound experience, which is what we hear every single time someone comes here and does a journey with us. It's really rewarding to see that. I haven't had yet one person say that this was not very meaningful since I opened this space.
Mm.
So that's really cool to see.
That is cool. One of the things that some people come into this conversation with, if, maybe this is the first time they've really seriously considered psilocybin therapy, is some of the stigma and, I mean, really, frankly, we're talking about misinformation from the past. So, we've all seen those kind of old PSAs like, this is your brain on drugs, the cracked egg in the frying pan. Can you kind of dispel that for us and talk about what the science shows from high level? What do we know about how the brain responds to psilocybin
Yeah.
and how that fits into the sort of outcomes that you're talking about?
Yes, that's a very important question. And I think it's so nice to be able to educate people because for someone who's not in the psychedelic space like us, there are many questions that, can come to mind, especially from biases from the past and like certain cultures that used the substances more for the party context. Um, yeah, so psilocybin is an incredible substance and a mushroom that has psilocin in it, which is the active ingredient. So when this active ingredient gets into the bloodstream, it promotes the psychedelic experience that is super powerful because what happens is that different parts of the brain that don't regularly communicate with each other, we call it the default mode network, become way more integrated. And there is this effect of calming the default mode network, which gets people to what they call a ego death experience, or just like the release or calming of the ego. And in that process, it's so clear that people have emotional breakthroughs that really can change their perceptions of themselves and the world. They're able to experience and relive. And when I say relieve, I want to be careful because I don't want people to be resistant to the idea. But when I say relieve past experiences, it's so important because sometimes with trauma, people stay stuck in the moment of the past. But when you have a guide and a therapist helping you through the process where you're relieving things that were difficult and you are able to move through it, that's when the body releases and you can have change. And so this substance is really incredible. It promotes that in the brain. It promotes these emotional breakthroughs and what we call neuroplasticity, which is the ability of the brain to really restructure itself, to create new pathways, and with that, promote real and last change for people. So it's just all amazing for the brain. There is nothing that is contraindicated with psilocybin unless you have a history of psychosis or, a heart condition. Like we do screen for certain things that do not make someone a candidate, but besides that, it's just positive.
Yeah, let's talk about that part. For somebody who's considering whether this might be for them, what does the process look like for medical screening to ensure that someone is, an appropriate candidate? And, to the extent that you do, like how do you personalize it, the experience for them?
Yes, we're very careful with that phase. It and especially because we follow a clinical model and we know the importance of safety. And so on our first call, on our first discovery call, we already start a screening process where we ask participants or potential participants what medications they're on, if they have support system. You don't want someone to come to this experience and go back to their lives without any type of support system. If they have a therapist, if they don't have a therapist, we want to make sure they're in a good place emotionally to where they can enter this type of experience, right? Because gonna open your brain and you're gonna expand possibilities for yourself. You want to be able to come back to life and be able to integrate that. And so, yeah, so, it's just a lot of dialoguing and getting to know someone. And then a really important part of it too is to understand if someone has a heart condition, like someone with heart condition cannot do this protocol, unfortunately. Someone with previous history of psychosis also cannot do the protocol. With family history of schizophrenia. There are certain medications that are not recommended to be combined with psilocybin. So at times we just refer someone to a psychiatrist if they don't have a psychiatrist, or send them to a psychiatrist for evaluation if they can get off of certain medications that perhaps the primary care provider just prescribed to them. And so it's just a really through process to make sure someone is a good candidate. And then after that, then we send them to a therapist who, can start understanding more trauma history, or if it's sometimes people come to us not because of any psychological issues. They just want to really transform their lives. But if they do have any of those medical conditions, then we also don't cannot have them as a candidate for this protocol. We want to stay on the safe side for sure.
Okay. Yeah, that's helpful. So you've mentioned a few different medical conditions or maybe some medications that would be exclusionary criteria or at least
Yeah.
factor into that decision.
Yeah.
But there are also probably like, let's say, mental states that are not necessarily diagnoses that might be something you're looking for. And in this world, there's this term called set and setting, which I think might be helpful for you to explain to the audience here. There's the set, which is the internal set, and the setting, which is external. I'd love for you to talk about each of those and how they fit into this process and how you've tried to manage each of those components.
Yes, that's very important, and thanks for the question. Well, SET, how you said, is the mindset. So that is something that we start preparing someone on the first phase, which is integration. But besides that, and before that, is to just really understand if someone is ready emotionally to enter a process like this, right? When I say ready emotionally, I don't mean that they cannot have depression or anxiety, but that they understand that this is a process. It's not just a magic pill that they're going to take it and everything is going to be solved. So it's a process of change that starts with this and has to be continued. So we evaluate for that. And then with the help of a therapist, once they enter the protocol on the first phase of it in the integration, then creating this mindset of, okay, what is that I want to work on? What do I want to achieve? How I want to proceed after this? Prepare yourself for the day of the journey and how grounding techniques so that you feel present in your body. That's why it's so important to have a therapist with you who can be there reminding you of all of those things. And then the setting is so important, as you know, because someone is gonna, spend this time in what we call a container that should be safe. And Numia was very careful in creating a space that feels very homey and comfortable, even though it's not in nature, it's like in an inside place. We have a lot of plants inside, and we make sure that it is curated for that, for comfort, for letting go, for dropping in and staying in the moment and letting the experience unfold. And so, yeah, so those are very, very important pieces of this for sure.
Okay, so what I'm hearing so far is that the basic, high level view of a client's journey working with Numia is they begin with preparation work with a facilitator, therapist, a clinical facilitator. Then there's the actual medicine administration, the journey, and then there's some kind of integration support. Can you unpack that a bit for us and take us through what that process might look like?
Yes, absolutely. And, a lot of people want to understand that because, in the calls we take, consultations call we take for people who are interested, sometimes they don't know that there is this process of support throughout. And so after the first screening, so that we can know if someone is a candidate, we send this person to a therapist for a fit call. We want to make sure that it's a good fit with a therapist. And if it is, then they start the process. So we have Numia, we do two preparations. The protocol only requires one preparation, but Numia, I realized as a clinical director, I wanted to make sure people had a lot of time with a therapist to prepare to create the alliance, which we know as therapists is the most important part of the work, is the alliance with the therapist. And so in this time, they're gonna, start developing an intention for the work. What is that they're trying to achieve with this process? Understand past traumatic experiences or reasons for why anxiety is part of someone's life, how they started feeling depressed, and other conditions, PTSD, or just, how I was saying, someone who wants to change their lives, find a new direction for it. And so it's two calls of an hour and a half each, where a therapist is going to have a phase of discovery, really understand what is that someone is going through, what's their history, family history, support system, what do they like to do in life. Also, give people suggestions on what to do to prepare for the journey. So, for instance, we recommend people to lower their intake of Instagram, social media, or TV, start paying attention on their intake of alcohol, and sort of preparing their body to receive the medicine. So I think that's one of the most important parts of it is this preparation to receive the medicine and to get into this space. And that's part of the mindset, right? This space of openness and to receive it. And so we also like to recommend grounding techniques, and so they can, depending on what they like to do. Like for some people, I like to recommend meditation. For other people, if that's not what they want to do, they can just start taking walks and be mindful in that way, right? Some people think meditation is just sit down and stay quiet, but you can find other ways of being mindful. So like really trying to get in touch with their body, their feelings, how do they experience things in their body. All of that's very helpful for the journey, and we make sure that people, find ways to prepare, and we guide them throughout it. And then on the day of the journey, well, obviously, if they're not from here, they have to come to Colorado. But in Numia, we have a concierge approach to the way we do things. So we make sure that they're cared for throughout the whole process. I know it takes so much vulnerability to come to a different place and do this. And sometimes people come alone, sometimes they come with a support person, but we help them find a hotel. We have a partnership with hotels close to us that can bring someone here, can pick them up, have a special menu for them for after journey. So it's like a light meal. And then so basically when they get here, usually they get to the center between 8 and 9 a.m. The therapist will be here ready to receive them and start, making them feel settled into the space, reminds them of their intention, start grounding techniques like breath work and meditation tools. And so sound bowl, anything that, we think might help someone drop into the space. And then we serve the medicine. We serve it in a way that is a little bit ceremonial, even though it's a clinical space. We find that each therapist have their own way of doing this, and we really allow for that to bring their own authenticity to the work. And so whatever that looks like, we encourage as long as we stay within the legal frame. And so, just help people really feel at home here. And so we serve the medicine and they wear an eye mask as part of the protocol. We really encourage people to go inward for the process so that they can really experience more without a lot of visual stimulation and things like that. We have music that's curated for them that's known to be efficient through research and through just experiences that we have in the clinic of what people like to be hearing when they're through these journeys and what helps them move through the experience. And so it's a lot of intention to it. It's very tailored. The therapist is with them the whole time. They are cared for and supported throughout the whole experience. And so when they're ready to leave, they have to stay with us for at least 5 hours. That's the minimum requirement. And so when they're ready to leave, they have a light snack and they leave. They're encouraged to just chill for the rest of the day, not consume a lot of social media again or TV. Then after that, we start the integration process, which is just as important as the journey, because like how I was saying before, is in this process of integration, and especially with the window of neuroplasticity that's created, that someone with the support of a therapist can really utilize this time and the neural pathways that have been created to promote change, to experience life in new ways, and to continue this journey for them and implement them into their life so it's meaningful and can continue to have results for the rest of their lives. So, yeah. And the integration process really is having someone there as a therapist who were with you during the experience, who knows what you went through and can speak with you about what was observed, right? Like it's process what you went through and make sense of it. Yeah.
Yeah, that paints a very vivid picture. I appreciate that. And I
Yeah.
imagine, our viewers now are beginning to understand why this is so different from potentially trying to navigate this process on one's own, to have all of the care of the facilitator, the therapist, and all of the surrounding, environmental factors that you've put together at Numia. So hopefully that's landing for people. And I can totally understand now why you said earlier that you've fortunately not had a single client come through and say that the experience was not profoundly meaningful for them. I'm sure that that is incredibly fulfilling work for you, and I'm happy for you that you get to do that. is there any, one story or favorite client experience that comes to mind that has really stuck with you, as reinforcement for why you do what you do?
Yeah, it's so many wonderful experiences that were related to us. It's hard to pick one, but I'll do that so that we can talk about one experience. Um, so we had this woman who came to do this journey. She's in her mid 60s. The presenting problem was that she had not experienced joy for the last 20 years of her life, extremely depressed, like treatment resistance depression. And after the experience, like I want to say a week later, right after she was already really in awe of all that she had seen during the journey, and she got in touch with things that she thought were really important for her. But 1 week later, she gave a testimonial of being able to experience joy for the first time in 20 years. So that was wonderful. To be able to not be anxious all the time and to have hope for the future. And so that's huge. And then I want to say 3 weeks after that, her daughter reached out and said that she was so grateful that she got to do this here at Numia, that she was so cared for, and that she had never seen her mother so happy that it looked like she was a different person. And so, yes, it's extremely meaningful. I haven't had one person come here and do not relate that they had a very profound experience. So the more we do it, the more we know that this is definitely a good option for people and that it can promote so much change and lasting results. And it's just how you said, it's very meaningful to do this, to be able to change people, help change people's lives.
It is. It is so
Yeah.
meaningful. And,
Um,
one of the things that gets me so excited about this field growing and unfolding before our very eyes, thanks to people like yourself, is that there's so many stories like that of people who have exhausted every option in the conventional treatment and to no avail. And then this works, which is not a promise, of course, everybody's different, but
yeah.
there are enough of those that the pattern is undeniable.
Yes, it's you said it right. More and more, especially having the clinic and seeing journeys all the time and the results. Because we know the science, we know the research, and it's very promising, but there is something about seeing firsthand in your own space these cases of people who are transforming their lives because of this work. It's really powerful.
What do you wish more people knew about psilocybin assisted therapy? Is there any sort of misconception out there that you see floating around a lot that you would like to correct or just missing information?
Yeah, I think people still do not understand the importance of the combination of the work of the therapist with the medicine, right? So um, this medicine alone, without for this protocol, without the support of a therapist, would not have the same results. So I think it's in this connection that we really get it to be so powerful. And I think this is actually a question I get from a lot of people. It's, can I do in calls that we receive all the time? Can I just do this at home? Do you send
Mhm.
it to us the mushroom? This lack of information on how this works, this protocol works. It's something that we will have to obviously face and help change. And also all the preconception just from how we were talking about, like thinking the psychedelics is a drug party and that it is for people who, it can be addictive. And we know that psilocybin is not addictive at all. And so, it's quite the opposite, right? It can change your life. Like for people with alcoholism, it can get them out of the urge to drink. Like in many cases, they're studies saying that. And so, yeah, it's just, just helping people understand that this is a serious protocol that can truly help change the landscape of mental health in the future. I truly believe in that. And so, yes, we need more educational pieces and we need people, we need it to become more mainstream so that more people have access to it.
Yeah, we got to get the word out.
We have to get the word out. Yeah.
Yeah, we've spoken a lot about the profundity of these experiences and how deep and life-changing they can be. And to some people, that's exactly what they want, and that's a life jacket. But on the other hand, that could also be intimidating. That could be scary, to even
Yeah.
consider doing something like that. So, what would you say to our viewers who feel some sort of draw to this, but are understandably nervous or unsure that this work is appropriate for them?
Yes, I think it's okay to be scared and unsure when something is so new. That's why we take our time explaining everything when someone books a call, a discovery call. I have all the patience in the world to explain to people if this is right or not for them. Um, and also understanding that it's just an extra tool. It's not something that necessarily is gonna, how I said, it's not a magic pill, but it's a protocol and a treatment that can help people experience life in a different way. They're gonna still be themselves. I think some people, and I've heard before, have this fear that they're gonna go through this journey and then they're gonna come on the other side like a different person. It doesn't have to be that scary. Like it's it's not as dramatic as that. But it is very meaningful nonetheless. And again, doing this for people who are scared, I think doing this in the legal frame, the way we have it here, with therapists who are trained in trauma-informed care, with all the screening process that we do, there isn't really any risks. I mean, obviously you can say things always have a small risk, but this is a very safe process. The way we've developed, the protocol was developed, and the way I have created things here in Numia. And I'm always happy to talk with people about it so that they can understand better.
Right. And that medical screening process is one more filter for any sort of risk that's there so that you don't actually go through with the experience if it's not going to be safe for you.
No, we are very serious about that. We
Yeah.
do not let someone come to the experience if we don't think they are 100% safe
Mm.
in that regard. And so safe emotionally, ready emotionally, we call it readiness. Like we want to make sure someone is ready for it. We don't want people to rush into it. We can help them prepare for as long as needed. We always want to do this in a way that feels right, safe, in someone's rhythm, and that makes sense to them, is tailored to their needs.
Okay. Yeah. So what is the next step for folks who are interested? How can they move forward with you and Numia?
Yeah, so they can schedule a consultation call, that's usually with me, to find out, more about the protocol, to ask any questions that they might have, um, to, find out if they're good candidates. Um, and that with that, we can see next steps. But people are welcome to just call us here at the clinic if they have questions, even if they don't schedule a consultation call, they're welcome to call us anytime. We consider that Numia is a community for people to come together and really, understand more what this is and belong to something.
Okay.
Yeah.
We'll end with one final question for you, Carolina. What's one lasting thought or word of encouragement that you want to leave our viewers with who are considering this journey?
Well, I want to say that if you are curious about this protocol, if you're tired of looking for things that are not working for you. If you have fear, but you also have curiosity that drives you into wanting to know more, don't hesitate to reach out. We are here to give support, to give real information so that people can make informed decision and come to a place that is based on the legal frame with real therapists that can support them and make them feel safe. And I think it's in the context that's going to bring the most results. So, yes.
Okay. Okay. Well, thank you, Carolina, for sharing this information today. Thank you, moreover, for doing the work that you do because it's incredibly important. And I know that it's difficult as well. So I'm grateful that you and other folks like you are taking this step to make this modality available to more people. And thank you to our viewers for sticking around and honoring yourselves by hearing us out and considering seriously whether this is something that you might like to do. This is really deep work, and I think we've underscored that in this conversation in a few different ways. But what's most important is that you know that you don't have to do it alone. So thank you for being here, and thanks once again, Carolina.
Thank you, Henry. Thanks for having me.